Hey, Claire, welcome back to Age Better.
Thank you so much for having me again, Barbara. I love talking with you.
I know you've been extremely busy lately. In fact, you were just in Washington, D.C. recently attending what is really considered the most important bone health conference in the country, if not the world, right? The Interdisciplinary Symposium on Osteoporosis. And so you were there, and the host is the Bone Health and Osteoporosis Foundation. And as CEO of BHOF, well, you were in the room where it happened. Please first just tell our listeners, what is the ISO and why is it such a big deal in the bone health field?
As we've talked about, I think previously, even there, no one discipline within the medical field owns bone. So you go to an orthopedic, obviously, if something breaks or you have an issue with bone. But for osteoporosis and other bone diseases, anyone, like your primary care, your gynecologist, a geriatrician, an endocrinologist, a rheumatologist, all of them, and an orthopedist, can treat osteoporosis. And so what makes the Bone Health and Osteoporosis Foundation and our conference unique is that it is a practical application of all of the science to help those who are really treating people in the field, in their practices, know what to do with patients when they come in presenting with either high risk factor for fractures or have had a fracture or who have many of the symptoms and risk factors for bone disease. And so that's why the ISO is so important. It's really given that practical application to doctors from across all of those different fields, and then being able to kind of discuss what's the latest information and science from globally that we know. And we are fortunate to being in experts from around the country and around the world. We had a couple global speakers this time, which was really exciting, covering everything that we think our docs need to know about how to prevent, diagnose, and treat bone disease.
Right. And what really stood out to you this year? Anything we should know about?
Yeah, I mean, unlike some other, disease states where there's a lot of new treatments or new technology coming to fruition, like devices to be able to, do an operation or something like that, we don't really have that in bone. So I think what was really interesting for me was, and this has kind of increased a little bit every year, is helping clinicians understand that exercise is medicine. And that goes a long way to what consumers and patients, what we feel and want to know, that we know that there's benefits to it. And so lots of good discussion and topics around the physiology and the importance of exercise as part of a treatment plan. And then, as is always the case when it comes to bone health and where like the newest, maybe, I don't know if it's the most interesting things are happening, tends to be around rare diseases. There's thankfully a lot being done to help people who suffer from these conditions that, again, families trying to figure out what's happening to their child. Why do they have this? Or later in life, what's happening to them with this? And realizing the interconnectedness of so many other different conditions and how osteoporosis plays a part in that.
So there was definitely some discussion around lifestyle, right? Like you just mentioned, exercise, supplements, nutrition, sleep even, anything you can do to help your bone health and your overall health as well. But anything new about that? And was that a bigger part of the discussion, do you find, compared to previous years, or what?
Well, we have also pre-conferences that happen every year. And one of the pre-conferences that we've been doing for the last 3 or 4 years is running our Bone Fit program. And Bone Fit is a program that we adopted from Osteoporosis Canada. They had a program that runs all throughout Canada, and it's specifically to train physical therapists and fitness professionals on how to support and work with people who have osteoporosis or at risk for fracture. Because I know you've talked about this often, and it's like, if you have osteoporosis, there are certain things that you might have to adapt or that you shouldn't do because you could increase your chance of having a fracture even though you're trying to do good by exercising.
Right.
So we have the Bone Fit training that happens beforehand. That training has really grown, and it was really nice to see that many of the people who were taking that course, which was a day and a half course prior to the start of the conference, stayed for the clinical part of the conference as well. And so I think what happens then, that's also nice about an interdisciplinary conference, is the questions that get asked are different, because not only are doctors asking questions, but nurse practitioners are asking questions, physical therapists are asking questions, even people with nutrition backgrounds, we have RDs and MDs that come in, they ask questions too. And so that makes the conversation around how do we address the whole person much more robust. And I think that's definitely been improving and changing over the last couple of years.
Yeah, and there's been so much talk and noise and conversation around exercise and lifting heavy and all that to really maintain your bone density, but also to build it back even in some cases, depending upon how heavy you lift. I'm thinking right now of like Dr. Vonda Wright, who is really a very loud voice, I think, out there for, longevity, menopause, and also bone health. And I know she really focuses on that whole prevention aspect. And
it's huge. I mean, anything
yeah,
we can
it
do,
is.
obviously, to strengthen our bones and our muscles, which protect our bones as early as we can in life, but no matter where we are in life, being able to do those things and to really make yourself as strong as possible is going to obviously help prevent something more severe happening down the road. If you just ignore it, it's not going to go away in this particular instance, especially with bone loss. It's going to increase. I think, like you said, learning more now about how impact exercise and how weights and weight strength training
Yes.
really plays a huge role in our physical skeletal health is really important, and it's fascinating. And we're working on, scientific studies looking at that, sort of what is the science saying about physical activity for bone health across the lifespan. And I'm anxiously waiting for that to come out, just to be like, okay, so what does the latest science say, right? It's it's not new science, it's a summary of all the great scientific knowledge that has been put out recently, and sort of a summary of that so that people can take that again and practically use it in their, taking care of their patients.
Yeah, no, that's going to be very, very important. I know you'll be back on when it comes out so we can talk about it. So let's talk about the treatment gap. That still is a huge issue, right? I mean, we talked about it for a long time when I was still on the board. And did that come up in the ISO this time around?
Yeah.
Really, what's being done to help more women get diagnosed properly and early enough too, which is a really big issue, of course, and then, of course, get treated.
That's right. That's exactly it, Barbara, is the idea that we have to start looking at bone health across the lifespan, and particularly for women as we go through different stages of life. All along the lifespan, we need to be evaluating and making sure that we're concentrating on bone health. What was really interesting was a couple of sessions that were discussing sort of sequencing of treatment, and what do we know about how, when a treatment is offered or applied, or what order it's given in, do the results change?
Interesting.
So, I know we've talked about this before too. Osteoporosis is a chronic disease. Like any chronic disease, diabetes or heart disease or whatever, you definitely can do things and make sure that you bring your ALC down to the right numbers, and diabetes, right? That you're on your statins and you're making sure your blood pressure is right. But you have the chronic disease of heart disease or diabetes. And so what you want to do is know that the treatment, what you're doing, diet, exercise, and whatever medicinal treatment you're doing, that's what's helping keep it going. Well, the same with osteoporosis. So we know that people have lost bone, but once you are on the treatment, there's certain treatments within the bone health field that have a longevity effect, right? So we talked, I think you've done studies, a podcast too, about the drug holiday, what we call it, right? You stop taking certain drugs after about 5 years because it's built up in your system, and you're going to have the benefits of it. It's going to continue to protect your bone a little longer, right? But when we're talking about women, and we're talking about the dramatic drop in bone density that happens around menopause, right?
Yes.
Loss of estrogen. Now more studies are being done to look at, well, wait a minute, what sequence we give someone treatment in, does that make a difference in how long that effect will last, right? And should there be a certain order that these treatments are given in? And so there was a lot of conversation around menopause, and when a woman has osteoporosis and knows that they have osteoporosis or have fractured, as we said, a diagnosis for osteoporosis can be not only a low, T-score on your bone density test, but if you fall and break a bone over the age of 50, that is considered an osteoporosis diagnosis. So for those women, can we start treatment in a way that's going to give them better benefit by going on perhaps the new treatments at first that do the bone building in addition to stopping the bone from degenerating?
Right.
What if you did that first, and then after a certain number of years, you just keep them on the bisphosphonates to just keep that bone building thing that's happened going longer, right? So it's kind of exciting that so much of the science is looking at that now, that we now have enough data and people have been on the new treatments for a number of years that we can start to look at that and say, oh, this might make a difference for people.
Yeah, yeah, no, that's very interesting. And that was like a gap of knowledge, really, like
Yes,
a gap of data. Now
that's
you have that data, and now you can try to help patients who need the medication figure out what's the best sequence and so on and
exactly
so
it.
forth. But there's another gap that I really want to talk about. And the other gap is the gap in diagnosis, because you did mention, oh, if you fall, but if you fall like I did, you know my backstory already. In fact, everybody does. I've mentioned it many, many times. I fell right after going through menopause at around 50, broke my arm, shouldn't have. And anyway, long story short, I did have my first DEXA that showed low bone density. And so, otherwise, if I hadn't broken my arm, who knows? Right now, I still might not know the
That's right, exactly
status
right.
of my bone. So that's a real gap in diagnosis that I think still needs, and you think too, of course, needs to be addressed.
It does. But there's so many other things that are playing into that as well, right? So
Yeah.
as you said, people don't know, about bone density. We're not taught about it really as we're growing up. It's, we're talking about our heart health and our brain health and our breast health, even for women's health. And no one talks about bone health, unfortunately. And then you don't have clinicians who specialize specifically, right? There's no specific
Nobody owns it.
osteoporosis
Right. Nobody owns
Right.
bones.
Nobody owns bone but we say that, but again, orthopedics talk about, and they have a program actually called Own the Bone, which does look at not just fractures, but then treating the osteoporosis underneath it. And that's so important that orthopedics are involved in that and that they do take an interest in that. But if they don't want to do that treatment, then they can refer to an endocrinologist or something, right?
Right.
But again, there's not enough of those trained in how to treat osteoporosis to be able to serve the 54 million people that are impacted by low bone density and osteoporosis, right?
Right.
So yeah, there's a huge care gap, and there's a knowledge gap, and there's
A knowledge gap and a diagnosis gap. And I mean, right now it says, oh yeah, when you're 65, you get that first DEXA, and Medicare will pay for it, or your insurance will pay for it. But that's kind of late.
It's late. It is. But again, coming at the healthcare system as a layperson, as not a clinician, what you learn about how these guidelines and how these things get pulled together, they're based on the research that is available.
Yeah.
And the research available said, up until this point, there's no real benefit of giving someone a bone density test at 50 when chances are they're really not going to impact them until they're older. So we're just going to wait till they're older, right? And that's kind of how the guidelines come about. It's like, yeah, because they're looking at a healthy population versus...
Yes. Yeah, it's so very confusing. And I do want to reference Dr. Vonda Wright again. She's been a guest on the show, and I really like a lot of what she says. And the good news is, for her and a lot of other medical experts out there, especially those who are involved in menopause, they are loud voices on social media. And I think that a lot of people at a younger age, I'm talking about maybe, perimenopausal, are focusing on their bones because these doctors are talking about bones. They're specifically talking about bones and lifting heavy and how that's going to be one of the keys to successful aging. So that's all really, really good. But she said something very interesting, not on my show, but on a different podcast. And I thought, wow, that's an interesting perspective. Claire, you and I, of course, know about the peak bone mass. Big study out that, our bones are their strongest when we're about 20, 30 years old. And then after that, the natural progression is we start to lose, bone density, men and women, unless you do something about it, and so on and so forth. So we know this already. But she said, because I was always thinking the most important decade, really. I mean, sure, you want to build up all of your bone density throughout your life. Absolutely. We know this to be true. But I thought, wow, what's really important is as you're going through menopause, you really want to take action, which of course you do. But she said the most critical decade is between 35 and 45, meaning before you even start going into the perimenopause years.
Sure.
So that it's kind of, like the peak bone mass concept. You just want to build up those bones as best you can so that your bones are ready for that drop in estrogen, which is coming, which is absolutely coming.
Yeah.
Right? And I just found that to be really interesting. So anybody, listening in right now, if you yourself are past that decade, as I am, okay, but still, do whatever you can. But maybe you have a daughter or a niece or a neighbor or somebody, kind of like fill them in on bone health. Like it's not an old person's challenge
No,
or health concern. It is a lifelong,
it is lifelong. And I
right?
think about that perimenopausal stage, right? That 35, and even, obviously some of the conversations are having around menopause, is that even much like menstrual cycles are starting in younger girls at a younger age, perimenopause is also starting for many women at a younger age. We're starting
You're right.
to see that as well, right?
Yep.
And as you said, if we know that this drop in estrogen is coming and that it's going to have an impact on our bone. It's not just, again, making sure that, because the bone has been built, like you said, to peak bone mass 25 to 30, but it's the muscle. Like that's why that loading and the fitness and the strength training is so important, because you want that muscle and bone together to be so strong going into that perimenopause phase. And I think too, it has something to do with building the habit at a younger age.
Yes.
If you start at that age and you're 35, whatever, then you're going to continue that through midlife and beyond. And whereas before, it's sort of like women approach midlife, they didn't know this was happening. And all of a sudden, again, postmenopausal, they're told, wow, your bones are shot, and this is what's happened. And they were like, wait, why didn't anybody tell me?
Exactly.
Good
Well,
news
that's where
is
I
people
was,
are
Claire.
telling us now.
That's exactly where I was, as you know, my backstory, right? 50, went through menopause, broken arm. Like, what? Where am I? Like, what? What's happening?
I've been fit my whole life.
And low bone density. I wasn't doing anything between 35 and 40 except working and taking care of my children and my husband and, life,
Yes.
right?
Yes.
My bones were not a priority, and we have to make them a priority, is the point. By the way, I think this is a perfect time to just mention, again, you've been on the show, we talked about it last time you were on, but that you founded the National Menopause Foundation. You are the founder and the head of it, and you've done a remarkable job with that. And of course, it's, even though you're CEO of BHOF, I mean, I don't know how you do it, Claire, but you do. But there's such synergy between menopause and bone health, as we know.
It's really important. It's really important. And, the good thing is I bring the conversation about bone to everything that I do with the National Menopause Foundation. And I think that's been great. And then likewise, a lot more conversation happening at BHOF about menopause and how do we address it and what do we do about the prevention thing, because now more people are talking about menopause and more data and science is available about, we know what we know, but we also know what we don't know.
Right.
And that's important too. And what we need to do is make sure that as women's health advocates, as what I think you and I both are, and I'm sure many people listening are too, is we really have to fight for that to continue. We don't know nearly as much as we need to know about how all of this is interconnected in women's health. And so we really have to fight for that research to continue and for there to be a continuous focus on women's health and studying women and how things apply to them versus, as you know, and we've talked about it, has been done for decades, studying men and then just applying it to women.
Yeah. So true. So let's talk about primary care doctors for a minute, because sometimes they are the first point of connection, a woman has between her and, her health. And you mentioned endocrinologists and rheumatologists and so on as orthopedic surgeons and the like. But what about primary care, your PCP?
Yes.
How can your PCP help you to focus more on your bones and maybe even help with the diagnosis and treatment?
Yeah, well, again, there are many fantastic PCPs and internal medicine doctors who do know bone, and obviously we have quite a few of them on our board. I'm also really excited that our current board president is a primary care doctor. He's a
Yes, he is.
practice doctor. And that was really important for us developing as an organization because exactly as you said, we can have specialists, but the majority of people just go to their primary care doctor. And so how do we get primary care doctors interested in focusing on bone in new and exciting ways? And it's just becoming so much more demanding for all of our healthcare professionals, given just the amount of people they need to see and the amount of diseases and things that we need to be treated for these days. Besides the common cold, the flu, all the other things that happen to us, then there's these complicated diseases, and they can be complicated. And we have made an effort to reach out to family practice doctors, and we do a lot of educational outreach to them to sort of say, we have all the information you need and can give you continuing medical education to be able to learn more about it. I think it's the same for all of us, right? It's time, right? It's how do we ensure that we are giving our healthcare providers the time they need to stay up to date on all of these kind of developments that are happening, and if we read in the newspaper and you see all of these things advancing and it becomes, oh my God, overwhelming how many things are going. Well, imagine you're the person that's supposed to know all of that and then respond to it when someone comes into their office. So I think how medicine and how healthcare is changing is that we as patients are becoming better advocates for ourselves. And we need to do a little bit of the work too, to know the basics. What's your family history, right? Do you know that? Are you able to find that out? And so that's hugely helpful when you go to a clinician to be able to do that. Keeping track of some of the symptoms or things that you're experiencing, right? When you break, like I said, if you broke your arm and then you didn't see your primary care physician for another 6 months or a year, you might not even remember to tell your doctor, oh, a year ago I broke my arm, right? So how would they know that you are actually osteoporotic now because you broke that bone? So
Right.
again, there's just has to be that shared decision making and discussion between the patient and our healthcare practitioners. They are really, as all of us, they are just as overworked and understaffed and trying to keep up on all of these things. And they have our lives in their hands, right? There's a great expectation that we have of them. And so the more we can do to support that relationship, the better.
Yeah.
And then those of us in the patient advocacy organizations, and again, those who provide clinical training, the more access we can give them to really good conference content or things that are going to make a difference and help them use their time wisely when they're taking time out of their practice or their weekend to come to our conferences, pay for it themselves to be able to learn this. The only benefit of that are for us, the patient, so that when they go back, they know what to do to help us. And I think, we've gotten a little bit away from that these days where we're harsh with our medical professionals about, oh, they only give me 15 minutes or whatever. They only get to bill for 15 minutes. It's not their decision.
Yeah, we have to remember that. Yep.
Yeah.
Yeah.
It's tough.
It's interesting because that was my experience is that, when I broke my arm, I didn't let him know right away because I didn't have my annual physical for like another 3 months or 3 or 4 months later. And then, but I did remember to tell him, but he became my partner because he said, you should not have broken your arm. You're getting a DEXA test.
Yes.
My answer was, what's that? Okay. And of course I got it.
Right.
And then the rest is history. And in partnership with him, I created what I called my personal bone health plan. And it's still working for me. All right.
But we all
18 years later.
Right. We all need a personal health plan, right?
Yeah, for sure we do.
And
Yes.
obviously, you and I want to make sure that bone health is part of everybody's personal health plan. But the same kinds of things, when it becomes overwhelming like that, I try to remind myself and others when we're talking about it, the things that we need to do for our health and it's always really like, we're trying to prevent some of the major diseases that we might have a family history of, or we might be predisposed to genetically, et cetera, et cetera. Well, the good news is that when we do adopt those healthy habits, it helps for all of those.
Yes.
Diet and exercise and good sleep. habits, all of those things.
Yeah, keeping stress at bay, all of
Yes.
that. I like to say, from head to toe, right? Your brain, your
Goes together.
heart, your bones,
Yeah.
your mood, your weight,
Yeah.
everything.
But
It's
don't think
all
about
good.
that though. Don't like when I think we get hung up on the like, or I'm guilty of that, right? Oh, I have to exercise for my, to get healthy to lose weight. No, I'm exercising for my brain health and for my
That's
heart
right.
health and for my bone health and for all of those things. And oh yeah, the added benefit is I will lose weight. Terrific, right? But it's really more, we should think of more of our whole body health and what do we want to do to improve our mood
Yep,
and our mental health and all of those kinds of things. And the good
that's
thing
right.
is, all of it can be done across the board if we develop good habits.
It's about good habits. It really is. So based on everything you saw and heard
Yeah.
at this ISO, Claire, this one, 2025 ISO,
Okay.
is the Bone Health and Osteoporosis Foundation going to be kind of looking ahead in a different way? Are you thinking about new research or new programs? Anything that came out of this year's conference that you want to kind of bring into BHOF?
Yeah, absolutely. And not surprisingly, it is around that menopause space. So the Bone Health and Osteoporosis Foundation Board and our Scientific and Medical Advisory Committee are working to develop a position statement about menopause and bone health and around estrogen in particular and hormone therapy, which is a big topic these days. So yeah, we're going to be doing more in that space, and we're also working on a lot more partnerships with other organizations around what we talked about, that exercise is medicine and improving our bone fit program and some of the other things that we can possibly do. And then I think part of it is keeping up to date on some of the new diagnostic stuff that's happening.
Yeah.
We talked about bone density tests, and we talked about the care gap. There's also in the screening gap and the diagnosis gap is because there just aren't enough clinicians who are doing bone density tests anymore because they could not get reimbursed for it, and so they could not afford to keep the machines in their offices. So now people are in
Unbelievable.
hospitals or imaging centers. So science and technology are kind of stepping in, and there are a lot more types of programs, both AI and device, et cetera, that are coming to market that are working their way through FDA approval to look at how else can we get at identifying weak bone, right? Or
Yeah.
fractures that may have already happened or the quality of the bone. And so all of that is developing. And that's going to be, I think, over the next 5 to 10 years, there's going to be a kind of a huge increase in where we go with those types of tools.
Yep. And
That's
embracing AI. For
mhm,
sure.
mhm.
Yeah, that's very exciting to me because, I mean, I've read some information, of course, through BHOF and my years being involved. And, I'm a big fan of TBS. Whenever I get my bone density test, I only go to the facility I go to because they also have that layer of TBS to take a look at what is the micro architecture
Yeah.
quality of my bones. Because, from what I understand, two women could have this kind of a similar DEXA, but if their TBS is a little bit different, it might indicate that one might need medication and one might maybe not yet. Just so there's these nuances
That's
that
right.
I think are, as you just pointed out, hopefully will become even more clear in the years ahead with this new technology.
And
So
yeah,
that's exciting.
you work with what's available, and we said for DEXA is still fantastic and a gold standard in being able to get people identified with those at the risk factor. But much like you having osteopenia and having a fracture, my mom broke her hip, and her bone density test was still osteopenia, right? So
That's incredible.
sometimes it doesn't, like you said, she clearly had osteoporosis. She broke her hip from just a standing height fall, right?
Right.
But again, the T score wasn't as low as it would have been on other people's. Again, like you said, all of this again, take advantage of the technologies that are coming forward and how to use them appropriately and effectively.
Yes.
And I think that's going to be, a challenge as always is in anything with technology, is keeping up to it and making sure that they do what they say they can do, right?
Yep.
And then we're giving people as accurate information as we can possibly give them about how to take care of their bones.
Yeah. Yeah. Just amazing. I'm excited about this, about the years ahead. So let's see what happens. And of course, I know you'll be back to talk about this. But before I let you go, Claire, this was an incredible conversation. Thank you for sharing everything you learned and heard in the room at the ISO, in the room where it happened. But do you have, I always love to ask this, what are your top 3 takeaways that you really want people to remember?
I think I really want people to remember that strength training at every age is important for our bone health. Again, that's kind of buzz topic words that are happening now. People are talking about strength training more, certainly around midlife and midlife women in menopause.
Yeah.
Really important. And I think we're only now learning how important that strength training really is to so many things with our overall health, right? But certainly to our bone health. So I think don't be afraid of the weights. It can be resistance bands. It doesn't have to be heavy weights. It can be just resistance bands. Anything that, again, allows you to do that. But again, the weight, adding that weight for, going to the gym and working with someone who knows how to work with you on that is really, really important. The second most important is, again, if you are perimenopausal, menopausal, or newly postmenopausal, please, please, please figure out what your family history is and make sure that you are having a conversation with your healthcare provider about whether or not you're at risk. And you might not be, right? But you need to bring it up because unfortunately that conversation may not happen naturally with your doctor when they're going down the list of things that they talk with in the well visit. More doctors are, which is great, and I love to see more and more of that. But please, be your own advocate. Ask the question about it. And if your healthcare, your primary care doctor doesn't know, ask for a referral. And they will gladly direct you to someone who can do follow-up and get you the information that you need. So those are the big takeaways for me, I think.
Absolutely. And I also want to remind everyone that this is the last episode in May of 2025. And May is National Osteoporosis Awareness and Prevention Month. And so we have been celebrating and honoring it, really is the better word, all month long with so many things. BHOF has had a slew of programs and webinars, and there will be a link in the show notes to all of those, everyone. So please do check that out, and always check out BHOF's website because there's always new information there. And I also want to take this opportunity to tell you that BHOF has started, and it's really rolling it out, a nationwide network of Be Bone Strong walking clubs.
That's right.
And I want to give you that information so maybe you can start a walking club in your neighborhood, in your community. And so just go to the show notes, but you can also email me at bebonestrongwalkingclub@gmail.com, and I'll give you all that information that you need. I started one in Virginia. I go back and forth between Virginia and New York, and it is rocking and rolling. We have a blast. We're socializing. It's like check, 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 check. Check all the great boxes. You're building community. You're socializing with your neighbors and friends and family, whoever you bring with you, and you are helping to do a good thing for your bones and your heart and your brain.
That's
all
right.
Good.
Right.
All good. All good. All right, Claire, thank you so much for joining me again. It's always so much fun, always a pleasure. And thank you for all the good work that you're doing.
Thanks
really
so much
good.
for everything you do, Barbara. We truly appreciate it. And I hope everybody has a great May. And we're doing walk a mile a day in May. So whatever days are left in May, make sure you get a mile in every day.
Thanks, everyone, for tuning in. Talk to you soon.